Morning, welcome back to my YouTube channel. Please don't forget to subscribe my channel and also please give your valuable comments. Now in the last class we have been discussing about the Ayurvedic aspects of Kasa, and we have seen up to Pittaja Kasa. Okay, so what are the different points that has to be considered? And we have seen there should be one Vatanulomana treatment, and we have seen there should be one immunomodulatory treatment. And when we come to the Pittaja Kasa, what are the symptomatology, and this can be best compared with the allergic type of different allergic or atopic type of Kasas, and the treatment, Madhurasa Pradhana drug and Vatanulomana drugs, Vatahara drugs should be given. So that portion we have already seen. And also we have seen the variants of Pittaja Kasa. Sometimes Pittaja Kasa may be there with the Pitta, sometimes Pittaja Kasa may be there with the Kapha. So both presentations are possible. The most important thing is Pittaja Kasa should not be over treated. That is a rule. Even allergic cough should not be over treated. Unwanted medications has to be avoided. Now come to the next important part, that is Pittaja Kasa. Now what you will consider when we see Pittaja Kasa, and what are all the conditions that we encounter in day-to-day practice which can be taken as Pittaja Kasa. Now mostly Pittaja Kasa can be associated with the Pittaja Jwara also, isn't it? Because we know that it may be a bacterial fever or it may be a viral fever. There will be Kasa always, isn't it? Cough will be there. Then on which category actually will put on this? It's very difficult. You cannot say that it is individually a Kasa disease. Okay, because it is associated with the Jwara. Jwara is the main symptom, presenting symptom. So a Kasa may be presentation of the Jwara also. Okay, so therefore this point has to be very clearly understood. Now in case of Pittaja Kasa, what he says is Jwara is there. That is important thing. In Pittaja Kasa there is no Jwara. Kaphaja Kasa there may be Manda Jwara and less problematic. Cough is not a most disturbing symptom. But in Pittaja Kasa there will be Jwara. So one thing is very clear when we talk about Pittaja Kasa, this is the Kasa which is associated with some of the infections or inflammatory conditions. Number one. Number two is if Pittaja Kasa, if not promptly treated, suppose if Pittaja Kasa, for example, take it as a allergic cough, if it is not promptly treated, then there may be the underlying mucosal irritation leading to inflammation also, non-infective inflammation also, and that may lead to Jwara also. Okay, so promptly treated Pittaja Kasa will go into subside, but if it is not treated normally, it may lead to Pittaja Kasa. Number one. Number two, Pittaja Kasa may be completely different and it may be associated with the fever and suggesting an infectious condition associated with the Kasa. Okay, so how we can say that this is somewhat related to inflammation or infection? Because if you look into the symptoms of Pittaja Kasa, so what he says is fever. Fever will be there. Then there will be burning sensation. Then there will be tiktasyata. And there is also sputum formation. There is also formation of the sputum. Okay, some inflammation has been taken place and some more irritation to the mucosal membrane has been taking place, and because of which there is more secretion, and that with the inflammatory exudates that mix together and it forms the sputum. See, in Pittaja Kasa there is no formation of the sputum, or alpha sputum is a krichasyata. That is very difficult to remove that. But in case of Pittaja Kasa, that is not the situation. Here there is a clear-cut formation of the sputum and fever is there, burning sensation is also there, and tiktasyata will be also there. Okay, again he says that the sputum which is present in case of Pittaja Kasa is visragandha. It is having bad smell. Okay, and it is of other different colors. For example, Harita, Pita Varna. Harita and Pita Varna. So again, associated with the fever and burning sensation and also formation of the sputum, and that sputum is having bad smelling or foul smelling along with the different colors. This clearly suggests that this is a exudates. Okay, this is exudate. So this is nothing but exudates and debris of the inflammation and also some excess secretional product of a mucosa. Okay, so this is exactly Pittaja Kasa. So one thing is very clear, Pittaja Kasa is associated with the inflammatory conditions or infectious condition, and that particular inflammation may be an infective inflammation, as it is seen in case of virus or maybe bacteria or some other parasite, or it may be sometimes non-infectious also, as in the advanced cases of Pittaja Kasa or allergic cough, which leads to non-infective inflammation and causing the fever and sputum, etc. Okay, so this is how we have to consider. Now, how to treat the Pittaja Kasa? How to treat the Pittaja Kasa? Now, this is clear-cut a condition of inflammation. So, drug of choice is very clear. We have to go for Amapachana drug. This is a condition which requires Amapachana drug. Okay, so Amapachana drugs has to be introduced. Maybe Maricha, Pipali, Musta. One of the best is Balachatrubhadra. It contains Musta. Okay, and then Nagakeshara. These are the very commonly used, even Shunti. So, these are commonly used Amapachana drugs. So when Pittaja Kasa is there, that means cough is there with the fever, cough is there with the inflammation, Amapachana drug has to be administered. It may be any of the following. Okay. And one more important thing is Amapachana can be also achieved by Langana also. Okay. Langana, the Lagu Ahara can also lead to Amapachana. We know that. Okay. Next one is even intake of the Ushna Jala. It is also Amapachana. Okay. It can also remove the Ama. Now here, as the Pitta is involved in this case, now we can go for Pratimarga Harana Chikitsa. Okay, so just like Rakta Pitta, the Kasa is also in Rakta Pitta also the movement may be in the upper part, in the lower part, or Tiryagata. Similarly, in the Kasa also it is Urdhvagata. Okay, so to make that Urdhvagata Adhogata because of this Apanavayu Dushti, to make it is reverse back the direction, you can use the Pratimarga Harana Eva Chikitsa. Okay, of course, although classically it is, I can give a very classical method, but practically this method gives a very good result. Practically, okay. So if you go for some Vire Chunopaga drugs, maybe Avipathika Chuna or something like that, it gives practically a very good results. Okay, so this is Pratimarga Harana Chikitsa that we can do. Another therapy or another treatment is aromatherapy. Aromatherapy means this is a condition we know that Pittaja Kasa, and we are also suspecting about the inflammation, infection, maybe bacterial, viral, etc. So we have to use certain drugs which are having the bactericidal or bacteriostatic or disinfectant quality. And we know that all the drugs which are having strong aromatic smell, they are basically considered as a disinfectant or antiseptic drugs. Okay, so we have to use these drugs which are having strong aromatic smell. So that has been named as aromatherapy. Okay, so we can use the drugs like Tulsi. Okay, Tulsi is also Rakta Shodhaka. We can use the Ela, or we can use the Bibitaka, or even Methi. Okay, so these are some of the drugs which are having strong aromatic drugs, and that drugs can be used in case of Pittaja Kasa. Another one is expectorant therapy. Expectorant, yes, there is formation of the sputum, and sputum has to be get expelled out, isn't it? So as there is a lot of thick sputum has been formed, lot of thick sputum will be formed, and that thick sputum may be sometime engulfed by the baby. Okay, and as a result, what happens? The infection which is present in the upper respiratory tract may be directly carried to the GIT, because it is indulging, it is engulfed in the sputum, it is consuming the sputum, it is not able to expectorate out. Okay, so that sputum goes to the intestine, and it may lead to a descending infection. Okay, descending infection in the GIT. So in case of Pittaja Kasa, we have to go for expectorant therapy to remove this kapha. Okay, so here there are so many drugs are there, expectorant therapy, for example Rasona, then Agastya, Apamarga. So these are some of the drugs which can act as expectorant. So many other expectorants are there. Okay, so even Yashtimod is also a good expectorant to some extent. Okay, now another important drug which can be used is Kapha Putihara Chikitsa. Kapha Putihara. Okay, kapha is that, it is sputum is formed, and it is also bad smelling. So kapha Putihara. We have got one of the best Kapha Putihara drug, that is Rasona. Lashuna is one of the best Kapha Putihara drug. Okay, so that can be used. Then we can go for other Pittahara treatment, like Pittahara drugs can be given in the form of the Panaka. Panaka, for example, Sharkara, Chandana, Amalaki, Draksha, etc. can be used. etc. can be used, and this can be used as a treatment. Okay, so this is actually the treatment of Pittaja Kasa. So if Pittaja Kasa is associated with the fever also, okay, Jwara also, then treatment for the Jwara is also given. Okay, along with that, this particular treatment for Kasa should be given. Amapachana drug is very important. Okay, Amapachana drug, it may also relieve the fever also, and also it relieves the Kapha, Pittaja Kasa. Now there are some of the variants of Pittaja Kasa. Okay, Pittaja Kasa may be associated with some other symptoms also. So that has to be considered, because only Pittaja Kasa, such situations are very rare. That means practically most of the time we cannot get a plain Pittaja Kasa, individual, isolated. Pittaja Kasa will be associated with some other symptoms also. So that has to be seen. Now, Pittaja Kasa may be there with Bahu Kapha condition. This is one problem or one situation where patient is having Pittaja Kasa, and we know that what is Pittaja Kasa exactly, and it is associated with the Bahu Kapha condition. Bahu Kapha means there is more sputum formation, excess sputum formation. There is a lot of copious sputum is formed, and it is also foul smelling. Okay, it is exudate type, and it can be forcefully excreted out. So we have to give such drugs which are a strong expectorant and which can remove this particular excess amount of the kapha. So we get one such situation. So when this situation is there, along with the Pittaja Kasa, patient is having fever, patient is also having Kasa, which is Pittaja Kasa. Along with that, lot of sputum is there inside. Okay, now in that condition, we have to remove that kapha. One of the best way that we can go for is can use the Vamanopaka drugs. This is quite beneficial. Okay, when the patient is having too much of this type of kapha, then you try to give the Sadhya Vamana to the child if the child is strengthy enough, if the child is able to tolerate. So Sadhya Vamana in a very small kids is quite risky. Of course, it can be performed, no doubt, but in infants and as well as the toddler group of it can be very easily performed. Okay, Sadhya Vamana. So you give some of the Vamanopaka drugs. For example, it can be little quantity of the Vacha, or it may be Yashtimadu Chuna, and give a good amount of salt water which is made in the hot water. That means Ushnambu mixed with the salt, and that can be given for the drinking, and then forcefully touch the throat area, and so that everything will come out. The extra amount of the copious sputum which is situated in the respiratory tract, so that is also coming out, and usually child get an instant relief. Okay, so this can be also tried. One thing, Vamanopaka drugs can be given, Sadhya Vamana can be done, then some of the expectorants can be given. Okay, some of the Pramati drugs can be also given. Pramati drugs, which are like so Pramati clears the shrotas. Okay, so it clears the respiratory shrotas. So even the Pramati drugs can be also given in case of this Pittaja Kasa with Bahu Kapha condition. Okay, there is another condition, a Pittaja Kasa with Tanu Kapha condition. Pittaja Kasa is there, but the sputum amount of the sputum formed is very less. Okay, thin sputum is there. Now here there is no use of giving this Sadhya Vamana or going for some of the expectorant, etc. So when such conditions are there, usually Tiktarasa is good. Okay, any drugs which are having Tiktarasa. So that gives a very good results. Another variant of this Pittaja Kasa is there with more Vataja condition. Now this is another situation. Okay, that means Pittaja Kasa is there along with the fever and Kasa, but along with that patient is also having excess body pain, pain in the chest muscles, okay, pain in the neck area, Kantordva, Uraso, okay, all some Vataja symptoms are also there. That condition can be very well treated with the Grita, which is both Vata Pitta. Okay, so Grita can be used in such condition. Pippaladi Grita you can go for it, or Marichadi Grita, Pippaladi Grita, or any other Grita preparations can be used. Okay, Saindavadi Grita, etc. And even you can go Brahas Saindavadi Taila application over the chest area and also the neck area, okay, which act as Vata. So this is about what you say, treatment of Pittaja Kasa. Okay, this is about the treatment of Pittaja Kasa. Usually we compare the inflammatory conditions, all the inflammatory conditions associated with the Kasa or fever associated with the Kasa. So we will consider this as Pittaja Kasa, and this is the protocol. Of course, the drugs which are mentioned may differ from physician to physician. Okay, there is no hard and fast rule that same drugs are used. Okay, I'm just giving the protocol how you have to treat it. Amapachana drug is must. Expectorant you can use. Okay, if it is Bahuka condition, then go for Sadhya Vamana or some other Vamanopaka treatment. Okay, and then if it is less kapha is there, then best is Tikta. And if more Vataja conditions are there, Vataja symptoms are there, then best is Grita preparations. And meantime, you can also go for Bruhat Saindavadi Taila or any other Lavana Tailas for external Abhyanga over the chest area and chest and neck area. So that is also quite beneficial. Okay, so this is all about a Pittaja Kasa and its a treatment.